worst service all the time, and you don't have a choice but to go to them in that space.
Did you know that the hospital is now withdrawing the funding?
I was told in a couple of days, but it seems silly to me that they should do that.
It says something when a patient from his hospice bed says he wants to talk. But that was...
Yeah, so this one is interesting. I'm the CEO of Precious Hospice. This actually is in the UK. This actually is not in America, but I'm going to be honest. As you watch the story, pay attention, because this is actually what should be happening to some degree. Not like this, but ahead of time, we should be maneuvering and getting patients out of the hospital before they pass. The notion to let patients pass in the hospital with the hospice in place, to me, it feels like the hospice is just paying the hospital some money for that bed. I could be wrong, but ideally it makes no sense. And it's not, in most cases, in the best interest of the patient at all.
But that was the strength of feeling in the building today, as news of funding cuts trickled through.
Came here and they've been absolutely perfect.
What's perfect about it?
Yeah, they couldn't be better.
Did you know that the hospital is now withdrawing the funding?
I was told in a couple of days, but it seems silly to me that they should do that.
But they, being Cambridge University Hospitals, has done this, confirming that they are withdrawing their £829,000 annual contract in 6 months' time.
So I'm still say, so the way they have their program set up there is actually much better than probably what it is here. Over there, they're paying the hospice company, or so the way I receive it. Ideally here, I don't think they work like that. I just can't not see an American hospital paying a hospice company, but I can see a hospice company trying to get into a hospital by paying the hospital a per day usage for each bed. Does that make sense?
In the American system, yeah, but isn't it all one system in the UK?
What do you mean?
Like their national health is all one integrated system. So it's not like the hospice section is going to need to pay the hospital section for that person. I mean, I don't know exactly.
There's no separate companies though, if I'm not mistaken.
I think it's all public. I don't think it's like the Japanese model of universal healthcare where it's private companies that get paid by the government. I think it's all a government organization. It's kind of like everybody's on Medicare. It'd be like if Medicare was paying Medicare for a Medicare bed.
I guess it could be, but then there'd be no reason for the contract. If it's all one government entity, there'd be no reason for a contract.
That's true.
So that contract to me is explicitly stating like the hospital is paying this amount to a hospice to facilitate this relationship, where in America, the hospice pays the hospital to keep other hospices out as best they can, which makes it, insane to me as a hospice owner. And more importantly, forget the hospice part, as a owner, it makes it terrible for the American people and patient choice. So you can choose to which hospice you want to go to when you go home, but they have it so that you can't choose which hospice you go to when you're in the hospital. To me, it's unfair. It's a lack of accountability, because let me say this, if we get to a point where we're taking away patient choice in healthcare, we're at a point where you might as well just chalk it up for people who are like literally just chalk it up, because you're going to get the worst service all the time and you don't have a choice but to go to them in that space. It's a terrible model. I've always said that even if I had the hospice contract, I would want it to run as a prime subcontract, meaning we give this prime the ability to pick other subs, or we work them together, but they have to pick. And I'm still a DEI person, right? Because I know that it's impossible as a woman and as a Black owned company to get these contracts, that you say, hey, you have to use other companies that can fit into this model. And then everyone gets a choice based on how to do that.
Going back to the original question though, like it does look like hospice is separate. I was mistaken from the NHS in the UK. But hospice is largely charitably funded.
Yeah.
So I guess that is a difference.
It is a difference, but ideally you still have to pay those workers. And so that contract, would make sense for me. But in America, the way we privatize everything, these hospice companies have just gone rogue essentially in trying to figure out how to get people, and honestly try to keep me out, right? I'm the biggest person that they have to deal with as a whole. So that's kind of where they're like, okay, this guy's getting on our nerves. How do we keep people from going to Precious? They can't keep them from coming to Precious, but what they can do is go and just hire, and I've said this multiple times, they go hire doctors that are higher ups in the hospital. And it's so bad in some of these hospitals that the doctors that are actually hired by the hospices go back to these social workers and sell them to use that same hospice. Like that's how insane it is here. And again, I'm not asking because I think you hire people from these other hospice companies and you ask them point blank, how does this work? And then they tell you, you're like, you're kidding. Then you hire another one from that company and they tell you the exact same thing. And you're like, even if I had the power to do it, I wouldn't do it. But to this guy's point, what we're getting to though is I believe that that's the right way to do it. I don't believe that people should die in a hospital. It's loud. It's uncomfortable. There's people coming in and out on checking on you all the time. That works in a setting where you're trying to get better, not trying to comfortably pass away.
What if someone wants to die in the hospital?
Very rare have I seen that. And in 10 years, no, literally in 10 years, I've never seen it in a case where the person wasn't homeless. Let me put it to you like that. I've never seen it in a case when the person wasn't homeless. Ever. So there you go. Right. So, and the next part of that, right? I've gone to an inpatient unit in the hospital and they're like, because people see you on the internet, they let you walk around a little bit. I walk down, said, what are you doing? I said, I'm going to see such and such. I did have a patient that wanted to come, so they were there. And I go in there and I'm like, why is everyone in here black? Why is everyone in here homeless? Like, that's the first time where I looked and I said, oh, this is a problem. Like, this really needs to be checked out because this is not a inpatient center where people are coming and can come and go as needed. They're literally being put in here and they're passing away. And it's like, why? Like, why do they have to die here? But, that's a different story for a different. But particularly for this case, I will say that is the right thing to do. Especially, and here's the biggest thing too, right? You have people who are this baby boomer generation. It's a totally different dynamic than what we expect. They're living longer. But now on the flip side, like we were talking before, I'm seeing, and we're all seeing, we just put on service someone in their 20s, right? This isn't the first time. We have kids too, right? We just don't talk about it. But someone in their 20s, and a lot of what we're seeing in these 20-year-olds, 30-year-olds, 40-year-olds is colorectal cancer because they're not going to the hospital or they're not getting checked out by their physicians, whatever. And then they come up and they're like, okay, stage 3, stage 4. The other part of it is too, back in the day, our parents would have just treat me whatever. And because you have some crazy social media influencers who are wellness influencers who literally don't know what the hell they're talking about, that literally say, don't take chemo, you can take some tea. And people are taking tea and they're dying. Those people should be held accountable for that shit. I'm going to say that, right? Like, you're literally convincing people, you have the power to convince people to not go to chemo and take some tea that are 30 years old. That should be on your hands. Right now, if you're going to tell me a 95-year-old, I borderline would agree. Most times I would agree because the idea that person can come back hardly ever happens, right? So that one I agree. But someone who has, and I always say 65 and less and younger, unless it has advanced to the point where, and there's just other cases, right? Where it's like, you just don't feel like trying. I always say, just try. But this is the right thing to do. They should move them out of the hospital. They should not be dying in the hospital. And they need those beds because people are living longer and they have younger people who need beds because they're also, death is imminent for them as well.